So in this last lecture segment for Module 1, we will discuss anatomical terms. We'll learn how to reference body parts and regions, and we'll also familiarize ourselves with anatomical directions, regions, and planes of sectioning. These are important because they give us a standardized and universally accepted language that will allow us to communicate quickly and effectively about the body. So in order to give us an initial reference point so that we may give direction to the body, we have to have and establish a standardized position. Anatomical position is our standardized reference position. So in anatomical position, the person that we are observing is standing upright, their eyes are open, their palms are facing forward, and their feet are flat on the floor, slightly spaced apart, roughly shoulder width. So even if the person that we are observing in a lab or clinical setting is sitting down, lying down, or is prone, we will assume that they are in anatomical position, and we will reference them as such. So from anatomical division, we can divide the human body into two major regions, the axial division and the appendicular division. The axial division refers to structures that are located along the midline of the body. So that is the head, the neck, the chest, and the abdomen. The appendicular division consists of, unsurprisingly, the appendages, which are also called the limbs. The limbs are the structures that are attached to the axial division and are referred to as either the upper limbs or the lower limbs. The upper limbs consist of the arms, the forearms, and the hands, while the lower limbs consist of the thighs, the legs, and the feet. So also from anatomical position, we can give directional terms that will help us describe where specific body parts are with respect to others. The term anterior means towards the front, and the word ventral can be used interchangeably with the word anterior. So either anterior or ventral are the correct term for describing an object or a structure that is in front of something else, or towards the front of the body. Posterior means toward the back or behind, and the word dorsal can be used interchangeably with posterior. Superior or cephalad means above, while inferior or caudal means below. Proximal and distal are terms that refer to structures that are on the limbs. Proximal is a structure on a limb that is closest to the trunk of the body. So for example, the knee is proximal to the ankle because the knee is closer to the trunk than the ankle is to the trunk. Likewise, the elbow is proximal to the wrist because the elbow is closer to the trunk than the wrist is. Distal is a position on a limb that is further from the trunk of the body. So for instance, the ankle is distal to the knee because the ankle joint is further from the trunk than the knee is from the trunk. And the wrist is distal to the elbow because the wrist is further from the trunk than the elbow is from the trunk. The term medial means close to the midline, while the term lateral refers to something that is further from the midline. Right and left are always with respect to the person that we are observing. The terms superficial and deep refer to structures that are either close to the external surface or far from the external surface. So the term superficial refers to a structure that is close to the external surface, while the term deep refers to a structure that is far from the external surface or more internalized. So in this diagram, we see that the skin is superficial to the muscles, while the muscles are deep to the skin, and finally the bones are located deep to the skeletal muscles. So this diagram here shows the surface anatomy terms for different parts of the body. The description of each term is located within the parentheses, located to the right of that term. So for example, instead of saying wrist, the correct anatomical term for the wrist is referred to as the carpal region. I would ask that you please take time to review these and become familiar with them, as we will use them all semester, and you are also going to continue to use them in your health science program. We'll see that lab report has plenty of practice questions on these regions as well. So for anatomical studies, the body is often cut, which is also called sectioned, along a flat surface called a plane. Imaging technologies such as CT or MRI allow us to look internally without cutting. And these technologies take images of the body along these flat surfaces or planes. And so what we end up with from these imaging technologies are slices, that is, images of three-dimensional objects. Sectioning planes use imaginary planes to slice an object in different ways and allow us to take the perspective of the object from that plane. The same object might look completely different depending on the sectioning plane that was used to slice it. So in this example, I started with a familiar object, in this case a banana, and I used two different planes to allow us to look internally at the banana. The purple plane on the left sectioned the banana at its width, that is, across its diameter, and allowed us to look through the middle of the banana, while the red plane on the right sectioned the banana along its length. Or the same sectioning plane can give us two different views if that plane is shifted. The green and blue planes give us two different views depending on where that plane is shifted to. So keep in mind that when we are examining diagrams that are constructed from CT or MRI images of the body, that we are viewing only a small piece of a three-dimensional object from one specific viewpoint. So there are four ways that an object may be sectioned by a plane, giving us four typical planes of sectioning. We'll start out with a median plane, and a median plane is a plane that sections the body or an object into a right and a left piece. If the right and the left pieces are symmetrical to one another, that plane is called a mid-sagittal plane. A frontal or coronal plane sections the body or an object, like an organ, into an anterior and a posterior part. The transverse plane sections the body or object into a superior and an inferior part. And finally, oblique planes are cuts or planes of sectioning that are made diagonal between horizontal and vertical planes. These are not frequently used because they are not straightforward to analyze. The three planes that we will see most frequently in our diagrams are the median, frontal, and transverse planes. So continuing our examination of internal structures, we see that the body's organs are contained within body cavities in the head, thoracic region, and the abdomen. The upper and lower limbs typically do not contain any major cavities and are largely packed with bone, skeletal muscle, nerves, blood vessels, and connective tissues. The two primary sets of body cavities are the dorsal cavity, which are highlighted in yellow in these diagrams, and the ventral cavity, which is highlighted in red. We'll begin with the dorsal cavity. So the dorsal body cavity can be further subdivided into the cranial cavity and the spinal cavity. The cranial cavity is continuous with the spinal cavity, and they are not physically separated from one another. The cranial cavity contains the brain, whereas the spinal cavity contains the spinal cord. And both of these cavities are very well protected because they are completely surrounded by bones. The ventral cavity is a little more complex because it has many more subdivisions than the dorsal cavity. The ventral cavity is subdivided into the thoracic and abdominal pelvic regions. These two regions are physically separated from one another by a structure called the diaphragm muscle. This is a dome-shaped skeletal muscle that functions in helping us draw air into our lungs during breathing. The thoracic cavity is further subdivided into different regions, which we will examine now. So the pleural cavities are the two lateral cavities of the thoracic region, and they contain the lungs. The superiormost cavity of the thoracic region is called the mediastinum, and it contains the esophagus and the trachea. Inferior to that is the pericardial cavity, which, as you may have guessed from its name, contains the heart. So inferior to the diaphragm muscle, we have the abdominal pelvic cavity. And these cavities, which appear physically separated in this diagram, are actually connected to one another and are continuous. They primarily contain the digestive and urinary system organs, although some reproductive structures are found here as well. So because the abdominal pelvic cavity is large and contains several organs packed within it, it's much more helpful to divide it into smaller regions for study. And so therefore, we refer to 9 different regions of the abdominal pelvic cavity. We'll begin with the 3 superior regions. The right hypochondriac region contains primarily the liver and the gallbladder. The epigastric region contains the stomach and part of the liver, while the left hypochondriac region contains the spleen. The middle set of regions contain primarily some of the structures belonging to the large and small intestines. The right lumbar region contains the ascending colon of the large intestine. The umbilical region contains primarily the small intestine, while the left lumbar region contains the descending colon of the large intestine. The large intestine borders and frames the small intestine because the small intestine is located more centrally in the umbilical region, and the large intestine runs its course around the small intestine. The final three regions are located along the inferior aspect of the abdominal pelvic cavity. The right iliac, which is also called the right inguinal region, contains the appendix, which is a small pocket-like region of the large intestine. The hypogastric region contains the urinary bladder, and the left iliac region, also called the left inguinal region, contains the sigmoid colon segment, which is one of the last regions of the large intestine. There are other sets of cavities that are located within the head. The orbital cavities contain the eyes. The nasal cavity contains the sensory structure of the nose and is also the beginning of the respiratory system. The oral cavity contains the teeth and the tongue, as well as salivary glands, and is a very important part of both the respiratory and digestive systems. The middle ear cavities contain small bones that move in response to the vibration of the eardrum, which helps to transmit sound to the sensory structures of the inner ear. And finally, other small cavities located throughout the body are the synovial joint cavities. These cavities exist between most of the bones of the skeleton, and they give our skeleton the movement that it is capable of. The synovial joint cavities are fluid-filled cavities located between adjacent bones, and the cavity itself is surrounded by a fibrous capsule.